Do you suffer from TMJ? Do you suffer from not being able to sleep? Well, our next guest may be able to help you, Dr. Chandwani. How are you?
Good. How are you?
Good. So you grew up in India.
Yes.
And you did your dental work there. So what was that like growing up in India? And how did you decide to become a dentist?
So I decided growing up in India was fascinating. It's great. A lot of culture, a lot of close, a lot of friends. And my dad was a physician, and it kind of fell in place after high school, went to dental school. So it was great.
Teeth, most people are born with teeth, right? So there's something about wanting people to be able to have a nice smile, or, what people don't realize, though, is how much health is involved in your mouth area.
Absolutely.
So many things are connected. And I had shared with you when I found out that you work with people that have TMJ, that I was in a car accident a long time ago, and that my jaw doesn't exactly sit perfectly. Like your ear is supposed to line over your shoulder, correct?
Correct.
Okay. What causes TMJ? What causes this joint to not function correctly?
It's a range of factors going from teeth grinding, genetics plays some role, stress plays a role, the actual anatomy of the jaw muscles, physiology of the muscles plays a role. So it's almost always somebody who suffers from TMJ disorders is almost always multifactorial.
Okay.
The accident played a small piece in, if you have any symptoms, your problem. Without some of the other factors, it may have been negligible, but in combination of like 8-10 factors, now you could have a chronic issue.
Now, people that suffer from TMJ, sometimes it also causes headaches.
Yes, very commonly.
Okay. It's like that old game. Your head's connected to your shoulder bone's connected to this. It's all kind of connected.
Right. Headaches are very common in TMJ disorders. At times, a lot of patients suffer from migraines. TMJ disorders can trigger a lot more migraines, so that could be an additional factor too.
How do you know if you have TMJ? Like, what would the symptoms be? I know for me, it's just like this pain that just feels like something like, and so I always try to rub it out. But what are some of the other feelings?
Pain, like you said, is classic. Other symptoms could be poor sleep. Morning headaches are very classic for TMJ disorders, teeth grinding, ear pain, ear stuffiness. And then a lot of patients have muscle spasms in the jaw. So those are the common factors.
And how do you treat that? As a physician, how are you able to bring people some relief in the TMJ world?
With the right diagnosis, the treatment is, of course, tailor-made. Overall, the treatment ranges from mouth guards. In my practice, I'm certified in acupuncture, so I utilize a fair amount of acupuncture in my toolbox. There's injections. Botulinum toxin has been used in certain cases. So those are the...
Now, do you also treat other types of insomnia, or mostly just related to the TMJ?
My focus is TMJ disorders, snoring, sleep apnea.
Snoring? Wait, doctor, did I just hear you correctly? Snoring?
Yes.
Okay. Growing up, my mom used to snore, and sometimes I'd take a nap with her or whatever, and then all I'd do is give her a little, okay. Now in my life, at the age of 56, I have no problem with my age. I snore. It's bad. I almost wake myself up. Yeah. At least 3 times a year, I'll be sleeping up. And I'm I'm waking myself up snoring. How can you possibly treat snoring? Because I want to know right now, and I'm sure our whole audience wants to know.
So snoring can be related to your upper airway anatomy.
Okay.
So ranging from the tongue kind of constricting your airway, it's essentially resistance in your airway happening due to either laxity of your muscles, looseness of the muscles, which is allowing it to close for a brief moment, and that's essentially snoring.
I'm going to come see you.
Anytime.
So you have 3 locations. You're in Connecticut, you're in New York City, and then you spend a day out on Long Island,
yes.
right? Okay, yeah, sign me up, Doc. I thank you very much for being here.
It's been a pleasure.
I always want to shine a light on people that are doing good things for the community and how you're helping others. And yeah, I think I might have become a patient. But thank you very much.
It's been a pleasure.
Snoring, yeah. Do you snore?
No.
Okay, I was going to say probably not. Hey, thanks for watching. So if you're a snorer out there or you have TMJ, you could go to his website because maybe there's a physician in your area that could help you. And we hope that you stop snoring and that you get out of pain. Be well.